Action SA blames the Department of Health for failing to place over 500 doctors at medical facilities. The second wave of COVID-19 has put many health facilities under severe pressure due to the shortages of doctors, but there are currently 40,000 vacant posts, while doctors and nurses are under pressure to treat the daily resurgence of cases in hospitals. Joining us now to help us understand the current situation is Dr. Angelique Coetzee, chairperson of the South African Medical Association. She speaks to us from Pretoria. Doc, a very good morning to you. Are you aware of these doctors who are supposedly sitting at home? These allegations, of course, being made by Herman Mashaba's party, the Action SA.
We are aware of, from SAMA's side, we are definitely aware of all these posts that has been, that a moratorium being placed on them. And whether it's 40,000, I'm not sure, but let's say even if it's half of that, it's still a lot. So it's not only doctor posts, I presume it would be nursing staff as well as allied. And the problem is that we are running in the midst of a pandemic that started already last year in March, April. And up till now, those posts are still being frozen. And due to lack of funds, if SAMA did ask some of the MECs to have a meeting with, up till today, we're still waiting for the MEC of KwaZulu-Natal. The MEC of Eastern Cape was very busy in beginning of December and said she could not meet with us. At least we met with the Northern Cape MEC, and we sorted that problem with the Kimberley Hospital. There was 33 posts frozen. Already they had doctors interviewed for those posts, but still the provincial department froze those posts. And they have opened it after we sat with them and explained that this is unacceptable. The constant answer that we are getting why this is happening is there's not enough money. Now, unfortunately, these posts, these posts that are frozen at this stage, it's posts that there has been money allocated to those posts. Now, what happened to that money? No one can tell us what happened to the money. It's not that the post was frozen and there was not money allocated to that post. Yeah. So in a pandemic, this is unacceptable.
Dr. Coetzee, I want to take this straight to the top, and I'm going to specifically name the Minister of Health, Dr. Zweli Mkhize. What has his response been to this? Firstly, around this issue of posts being frozen at a time when the country's healthcare system demands of healthcare workers that every single one of them just this weekend, reports suggesting that there are going to be some 6,000 people who are going to be going around vaccinating people. I can't imagine that there would be a doctor sitting at home or posts frozen by the department because there's no money.
Okay, so this is actually not so much a National Department of Health's problem, but the provincial problem. And the provinces are autonomous, so they get their budgets and they need to do what is the correct thing that according to what they budgeted for. So the problem is lying at the offices of the premiers as well as the MECs of health and the provincial treasury. So that is, it's totally unacceptable that different provinces has different structures. They have different ideas. And again, we have just seen about 1,000 plus medical ComServe doctors. Now, that is doctors that after they have done their internship, they do a year medical ComServe or community service. And we know that a lot of them were looking for posts, MO posts, but they, due to the moratorium on the post, they are not placed. So the only choice that I do have is to go into private practice. Now, to go into private practice at this stage with a pandemic, especially if you want to start up a practice, it's going to be extremely difficult. So those doctors, the question is, what are they doing? So we will reach out to them. I need to say that last year, SAMA did supply the minister. He asked us names of doctors that was not employed. We submit a whole list of them, and they tried, National Department of Health tried to employ most of those doctors. But I also need to say that not all doctors are always honest, because some of those doctors have not been registered in South Africa, and some of these doctors also don't want to go and work in the rural areas, where currently they are much needed. They prefer to work in the urban areas. So it's not only National Department of Health or Provincial Department of Health that is in the wrong here, but sometimes there are doctors as well that make use of the situation.
And Dr. Coetzee, I can tell you that we're very thankful, because what you're painting now is a more nuanced picture. It's not in black and white, as sometimes many of us tend to think it is. So doctors themselves at times are to blame, as you mentioned. They don't want to move to rural areas. But I am still going to hop on the issue of then, why would the provinces not do their utmost to ensure that these doctors are absorbed in these posts? Let me ask you the question. Which province has the most amount of vacant posts right now?
That I don't have that figures with me, but as far as we are understanding, it's nearly all provinces. It's not there's except for the problem in Northern Cape that we have managed to solve. There would be other clinics and hospitals as well in the Northern Cape. But your big tertiary institutions must run in full capacity. You have to understand that those tertiary institutions are also they need to train the intern doctors, the young doctors that only beginning or the end of last year still were at university. They need a two-year training program. And the doctors that normally will train them are the medical officers and the specialist groupings and the registrars in hospitals. So if you run at a loss and you don't have enough doctors, so that also compromises the training of these young doctors, and it's a huge problem. And then on top of it, you've got COVID-19 to deal with. So the first place that one needs to start with is the tertiary institutions. Make sure that those posts are filled. Again, this is not new posts what we are talking about. This is existing posts. And we need to fill them. And I don't want to hear that there's not money. That's not my problem. Also I said that exactly in the same meeting with the Northern Cape. It's not SAMA's problem whether you've got money or not. You've got an obligation towards the public. You've got an obligation towards me who's a taxpayer to make sure that the public hospitals are staffed correctly.
Dr. Coetzee, two quick questions to you before we end our discussion. The Steve Biko Academic Hospital overflowing and temporary wards have had to be erected in parking lots with they being sheltered with tents. What's your assessment of the situation there? And I can imagine the kind of pressure that some of your members who are doctors are having to cope with.
Well, this is what we call a disaster. The Premier of Gauteng a week or two ago said that, Gauteng is fully prepared for the COVID-19 wave. This just shows you the difference between what is reporting to the top politicians in the province and what is actually happening at ground level. I know about the problem of Steve Biko already last week. This is not only happening over this weekend. This has been going on for more than a week. The problem now, what you are sitting with, because it's a tertiary hospital, it's a training hospital, that's a tertiary hospital, it's a training hospital. So the other hospitals that drain to Steve Biko, they should have been equipped by now with proper ICU beds, proper training of nursing staff, proper training of the doctors, enough oxygen, enough PPE to take the burden off a place like Steve Biko. So Steve Biko in the end become a dumping zone for all of the other hospitals that doesn't have enough infrastructure. So, from SAMA's side, it's not that we didn't expect that there's going to be a second wave. We all know that there was going to be a second wave. SAMA started to warn already in October last year that there will be a second wave. And nothing has been done. So these hospitals that cannot treat these patients, What happened? Why was there not training? Why was it not enough oxygen? And what about field hospitals? Where is the field hospitals?
Yeah.
It doesn't make any sense.
Yeah, and that's a very good question, because Nasrec, the Nasrec Field Hospital, was built for exactly this kind of eventuality. Dr. Coetzee, I wonder if you're still with us. If you're gone, totally understand. I'm out of time as well. But if you're still with me, let me ask you this quick question, and very briefly. Yesterday, I spoke to Dr. Emmanuel Taban. He's pioneered this bronchoscopy procedure for COVID-19 patients, and he says thus far he's saved over 40 of his patients. What is Summer's assessment of this, and would you advocate for this procedure to be used or allowed to be used in South Africa to treat COVID-19 patients?
Well, for now, we still need to have the data. We need to get all the evidence. If you can send us that evidence, the peer-reviewed article, we would gladly look into it. In a time of a pandemic, we need to look at each and everything that might help us, and not just throw the baby out with the bathwater. We need to look at everything. So we would be glad if you can send us some data.
All right. Dr. Angelique Coetzee, thank you very much for your time. Chairperson of the South African Medical Association. You heard her there, not mincing her words. The situation at Steve Biko Academic Hospital, total disaster.